Hello everyone, I hope you're doing well today. Today we're going to be discussing the Beckman-Coulter heart failure study, and this is an RC study, which means that the RAs are not allowed to consent patients for the study, and only the RCs can. However, RAs are still responsible for screening for patients who potentially qualify for the study and notifying the RC of the potential patients, as well as assisting them in the enrollment process. So first, let's cover the basics of the study. The principal investigator for the study is Dr. Mills, and the purpose of the study is to determine the levels of natriuretic peptides in the blood when patients have heart failure, and then this information will then be used to develop new blood tests that in the future might be able to help physicians diagnose heart failure and determine its severity more easily. Now, before diving more into the study, let's talk more about heart disease broadly, as well as discuss what these natriuretic peptides are and how they are related to heart failure. According to the CDC, heart disease is the leading cause of death in the United States, with over 650,000 Americans dying from heart disease each year. The most common complication of heart disease is heart failure. And heart failure means that the heart cannot pump enough blood to support the other organs in the body. Therefore, in individuals who've had heart failure, there's a lack of oxygen delivery to the other organs and other various areas. And there are several risk factors of heart failure, and they could be divided into two categories. One is more related to medical conditions, and the other is more related to unhealthy behaviors. Some medical conditions that can cause heart failure are coronary artery disease, diabetes, high blood pressure, and or obesity. In addition, unhealthy behaviors such as smoking, excessive alcohol intake, not getting enough physical activity can also increase the likelihood of heart failure. Here are some common symptoms of heart failure. The first is shortness of breath, or the medical term for it is dyspnea. The second is having trouble breathing when laying down, or orthopnea. And then there's fatigue and weakness, as well as swelling in the legs, ankles, and feet. Now that we talked about heart disease generally, let's now talk about what natriuretic peptides are. So these are peptide hormones that are synthesized by the heart, brain, and other organs, and the release of these peptides by the heart is stimulated by atrial and ventricular distension, which is any swelling or increase in internal pressure. The function of these peptides is to reduce pressure by decreasing volume and systemic vascular resistance. Now, in order to relieve pressure, NPs act by directly dilating veins. They can also dilate arteries, which decreases systemic vascular resistance and systemic arterial pressure. Overall, NPs can decrease blood volume, atrial pressure, central venous pressure, and cardiac output to make sure that that distension is relieved. So let's now talk about the relationship between NPs or natriuretic peptides to heart failure. Now, since NPs are released when there is increased pressure or swelling, low levels of NPs are particularly useful for screening to exclude for heart failure. For example, when a patient presents with shortness of breath and they are screened to check for NP levels, a low level of natriuretic peptides would mean that the shortness of breath is not related to heart failure and could be related to other issues such as COPD. Therefore, screening for NPs means that we have an excellent ability to exclude active heart failure from non-cardiac causes of heart failure symptoms such as dyspnea. So going back to the purpose of the study, by collecting and better understanding the relationship between NP levels and the severity of heart failure, we can then use this information to help develop new and more effective blood tests that can help physicians diagnose heart failure and determine its severity very specifically. Better understanding the relationship between NP levels and severity of heart failure can also help guide different therapeutic avenues. So now that we've covered natriuretic peptides and their relationship to heart failure, let's go back and talk more about the study, especially the inclusion and exclusion criteria. These are the inclusion criteria for BC heart failure. And for this particular study, all of these inclusion criteria must be met for the patient to potentially qualify for the study. The first inclusion is an age inclusion. It states that we're only going to be looking for patients who are 21 years of age or older. The second inclusion criteria states that the subjects have to be presenting with clinical suspicion of heart failure, and the third states that the subject's clinical history must be available for review. This is a closer look at the last two inclusion criteria. The second inclusion criteria stated that the subjects must be presenting with clinical suspicion of heart failure. This means that they have symptoms related to heart failure, such as shortness of breath or edema, and the physicians believe that these symptoms are closely related to heart failure. The last inclusion criteria stated that the subject's clinical history must be available for review. This means that we have access to their chart. And in the ED, we don't always have access to all of the patient's charts. Some patient charts that we can access are charts for patients who are prisoners, as well as patients who are 5150. Therefore, these vulnerable populations will not be included into the study. So now let's move on and talk about exclusion criteria. So here are the exclusion criteria for heart failure study, and if any of the things in this list holds true for the patient, then they do not qualify to take part in the study. So the first exclusion criteria is dyspnea, which is shortness of breath, is clearly not secondary to heart failure. And an example of this would be if an individual comes in with shortness of breath, however, it was later found out that this shortness of breath is due to lung disease and not related to heart failure, then they would not be qualified to take part in this study. The second exclusion criteria states that if a patient has stage 4 or stage 5 chronic kidney disease, they would also not qualify for the study. And this is defined by a GFR of less than or equal to 29. And GFR stands for glomerular filtration rate, and it indicates how well the kidneys are working. So a GFR of 60 or higher is in the normal range, and any lower than 15 may mean kidney failure, while in between those two numbers may mean kidney disease. The third exclusion criteria states that subjects who are on chronic dialysis would also be excluded from the study. And the fourth exclusion criteria states that if a subject is participating in another clinical study that may interfere with this participation in this study, it would also be excluded from the study. The second to last exclusion criteria states that if there's anything that would place the subject at increased risk or preclude the subject's full compliance with completion of the study, they would also not be able to participate in the study. And the last exclusion criteria states that subjects who are not English speaking will not be able to take part in this study. So let us now discuss our role as RA for the study. Our primary role is to screen for patients and report to the RC when we identify a patient who potentially qualifies for the study. So how do we identify patients on EMR? So let's start with the inclusion criteria. So the first inclusion criteria was an age inclusion criteria, which stated that we're going to be looking for patients 21 years of age or older. So that would be our first step in screening for patients. Another inclusion is that there needs to be a clinical suspicion of heart failure. Therefore, we're going to be looking for chief complaints that indicate that the patient is experiencing symptoms of heart failure. So some chief complaints to look for are dyspnea or shortness of breath, uh, heart failure or CHF, which is chronic heart failure, or orthopnea, as well as edema. We can also look at labs or imaging that has been ordered, which could indicate a suspicion of heart failures. So some labs that we could be on the lookout for include BNP or N-terminal proBNP. And both measure the concentration of natriuretic peptides and help diagnose heart failure. So if either of these tests have resulted abnormal, we can look further into these charts and ask the physicians if there's any suspicion of heart failure. Other than these lab tests, we can also check to see if certain imaging was ordered. Example includes electrocardiogram, which is a test that looks at the heart electrical activity and rhythm. And we can also keep an eye out for any chest x-rays that are ordered, especially if the chief complaint of the patient is related to symptoms of heart failure. The chest x-ray can tell whether the heart is enlarged or if the symptoms are due to problems in the lung. Another responsibility that we have as RAs is to help fill out the source documents, which are filled out when the patient is being enrolled in the study. So in our next slide, we're going to be looking at the source document. Here are the 2 pages included for the source document worksheets. On the left side of the screen is page 1, and on the right is page 2 of the document. Going from top to bottom, we need to fill out the subject ID, date and time the consent took place, how the blood to test NP levels was drawn from the individual, and what follows is a checklist that we provided the patient with the necessary documents and that we obtained informed consent before proceeding with the study. Below this, we have the Nyha scale, and this is filled out by the physician who's in charge of the patient. This scale places patients in one of 4 categories based on how much they are limited during physical activity due to heart failure. And on the second page, we'd also have to ask the attending where the patient falls on the pedal edema assessment scale. And an edema refers to visible swelling caused by a buildup of fluid within tissue. And this scale is a grading scale for that edema. And that concludes the presentation on the Beckman-Coulter heart failure study. I hope that was helpful to you all, and thank you all for watching.